I'm Nick Vogelzang. I'm a medical oncologist specializing in chemotherapy, and I've been involved in treating mesothelioma patients for almost 30 years now. Well, my opportunity to participate in cancer research over the last 30 to 40 years has given me a perspective that I think that is quite helpful. We used to have 50 to 60 drugs available. Now we have well over 100. And therefore, applying those drugs to the individual patient is the biggest challenge we have. There are restrictions on what we can give to certain patients. It's called the insurance companies. Yes, the need for clinical trials is obvious because the mesothelioma patients given Alimta and platinum will sometimes have benefits lasting for a year or two or three, but in the majority of patients, the cancer starts growing back within 6 to 12 months after completion of chemotherapy. In the world of insurance authorization, there are what we call compendia. The insurance companies have a list of drugs that they will allow the patient to be treated with. They may not be exhaustive, they may not be complete, but at least there are usually drugs to try. So generally, a patient who has already had Alimta and platinum can get a drug called Gemzar or gemcitabine. There are often patients who can also be treated with adriamycin or doxorubicin. And many insurance companies are quite liberal and allow the doctor to use anything on the older list of drugs. However, the new drugs do require informed consent, and that means the patient has to volunteer and follow a very strict recipe for treatment. The question always comes up, is there going to be a placebo in the clinical trial? That means a sugar pill instead of the real stuff. If that is the case, it's rare. The most clinical trials in mesothelioma are what we call phase 1 or phase 2, which means that you will get the real stuff. It's rare to have a phase 3 placebo. Now, in the trial I did of Alimta platinum versus platinum, there was no placebo. The patients knew they were getting either drug 1, namely platinum, or 2 drugs, but they had to accept the fact that they were only getting 2 drugs or only 1 drug. But a recently completed trial did have a placebo control, and that was a real testimony to the patients who volunteered. We always inform the patient of exactly what is likely to happen to them. And in the studies where there is a placebo or sugar pill, we tell them what their odds of getting it are. We try to bias in favor of the treatment arm. So what we do is called a 2-to-1 randomization. That is, the patients who are going to get the real stuff have twice as likely chance of getting it as those who would get the sugar pill. The average patient with mesothelioma comes in with one of usually 3 symptoms. They usually have shortness of breath, they usually have chest pain or weight loss. Most of the time they go to their family doctor. The family doctor does a chest x-ray, sees a fluid in the lung, and sends them either to a surgeon or a lung doctor. The lung doctor or the surgeon then does a biopsy. And oftentimes they go to the surgeon, and the surgeon may or may not be an expert in mesothelioma and will sometimes take them to the operating room for further testing. It's critical that those patients, once they are told they have mesothelioma, should get to a medical oncologist who understands and has treated mesothelioma. Fortunately, there is the 2-drug combination of Alimta and platinum that most medical oncologists understand, use, and are comfortable with.